just outside of Mbabane, the capital of Swaziland, where Sanlam is hosting its annual general meeting to hear from health experts how they're going to be improving the working conditions of Southern Africa's nurses and midwives.
Sanlam is the Southern African network for nurses and midwives that is aiming at improving the healthcare services in the region, including social policies on health, on AIDS, and we are aiming at strengthening the National Nursing Organization in each member state. Despite the fact that we are faced with the challenge of HIV and AIDS and other critical health like malaria and so forth, we find that most of the health resources are depleted. And we are on our own as a national nursing organization. We don't have fund sufficient. The poor countries are among themselves in cooperation, in partnership. But developed countries that are willing to assist us, like Canadian Nursing Associations and the Norwegian Nursing Association and Codate from Netherlands. They are funding us and they are willing to go on with us. That is why we said we can't depend on them entirely. We need to develop our strategies for self-sustenance. So it's for us to motivate our members to initiate self-sustaining programs.
We have seen the impact of the regional meeting, but most of the ideas, we get them from the Sanlam, and it is really important now because we have a strategic plan. And so from the strategic plan, we want to review what is it that we have done after 1 year. So we know we are going to benefit a lot because after learning, we also conduct some trainings at home.
Mainly, I've learned that what I thought was a problem in my country, it's a challenge in the entire region. So that has given me the oomph to say I should not give up. Instead, I must really work hard to make sure that we change some of the things that we thought there were problems. Because there are some of the things that don't particularly need money. We just need to change our attitudes towards certain things. We have to have good negotiation skills with our different governments so that we probably get what we want.
Such organizations are very, very important in terms of how far this organization can reach in terms of advocacy, in terms of influencing and shaping health and social policies. Of course, using HIV/AIDS, which is a burden in this region, as an entry point, but to advance and address other critical health challenges which the region is faced with.
We must lobby for a nursing directorate because you can't say nurses are the backbone of the healthcare services and you don't have a nursing directorate, because nurses, you find them all over. Whether it's a big hospital, it's a clinic, whether it's during the night or during the day, that is the importance the nurses are bringing. So those are the tricks and information that we're sharing amongst ourselves.
Especially at this difficult time of having to fight against HIV/AIDS and other critical issues. So I must say really this is quite a challenge to all of us in the regions. Because as a nurse leader, I know that I have got to scout around to go and share information with other nurse leaders so that I can take it home and then implement it in my nurses association, because all we want to see is the nurses associations in our different countries growing from strength to strength.
And of course, if you are to look at Lesotho, you look at Malawi, they started the association from nowhere, from receiving donor money. But they use that to also start from scratch a nursing association and make sure that it becomes stronger day by day. So those are the tricks that we are learning, so that even if you do have a nursing association in your country, what you learn from them is that we all as leaders need to have really, really broad visions. And you are learning tricks on how to strengthen your own organization association when you get back home.